Let's talk about nipple necrosis. Why does this happen and what can we do? So this problem, like many of the issues we see with plastic surgery procedures, has to do with altered blood supply. So the types of surgeries where you can see this complication are going to be things where the blood supply is changed. And that's going to be, in general, mastectomy patients, so our reconstruction patients, breast lift patients, as well as breast reduction patients. Now, sometimes this problem happens because the surgeon is too aggressive or does something that is too aggressive that alters the blood supply too much. But this also happens sometimes when patients just have an abnormal blood supply. So the blood supply to the area is not how we would expect it to be, and we do our normal surgery and then unfortunately have this problem. And no, I know someone's going to ask it. We don't have any type of simple test that we can do to figure this out before surgery. So unfortunately, this is something we find out when we do the surgery and then we manage it as we encounter it. So if you have this problem, it's really important that you have an attentive surgeon that jumps on it right away, because there's things that we can do that can hopefully improve the blood supply to the area that's struggling. So first of all, if the area is very swollen, then sometimes the best thing to do is actually remove stitches and allow the area to breathe, so to speak. And hopefully that would bring some extra blood flow in. The next thing you can consider is hyperbaric oxygen therapy. So since the blood flow to the area is decreased, if we pump extra oxygen into the blood, we can bring more oxygen in that diminished blood supply, and hopefully that can help. And this is often a covered indication for hyperbaric oxygen therapy. So insurance will often cover this in patients that develop this problem. And then finally, there are basically two topicals that most of us will use. We all have a preference for one versus the other. So one of them is nitro paste, the same stuff that your family members may use for chest pain. This actually dilates the blood vessels in the area, and we hope that it brings a little more blood flow into the struggling tissue. And then the other one, which I actually prefer, is called DMSO. And this also can dilate blood vessels, but it's in addition a free radical scavenger. So when cells are struggling and they're producing free radicals, they can be harming more normal cells around them. And so hopefully that medication would prevent that collateral damage as well. Now, the most important thing in my experience when managing these patients is not to intervene too quickly. Even if things look really bad right after surgery, with all of the proper care, sometimes things will recover and you won't lose as much tissue as you think you are. So it's really important not to jump in the next day and remove everything. You want to give it time to heal, do all of the methods that I mentioned to improve blood flow to the area, and give it a chance. Now, if all is lost and the tissue has not made it, then yes, you remove the tissue, you close things up, and then you can go ahead and reconstruct. And so that can be done in very simple ways, just like a 3D tattoo, and more complicated ways where we do small surgeries that can recreate the nipple itself and then tattoo or skin graft around that. And all plastic surgeons are facile in these reconstructive methods, and they work really nicely. So again, this is not a common problem, but it is a problem that should be managed quickly and properly by your plastic surgeon if you have it. So this is really the reason why you choose a good plastic surgeon who is going to be there for you if you need them, because it's not fun, obviously, to go through as a patient, and it feels very uncomfortable to not have support. And you want your surgeon arm in arm with you, helping you through this difficult time.